Everyone. My name is Shannon Alaba, and today I want to go over the project I have been working on. It is for the cholera outbreak in Ghana that started in 2024 and is still ongoing today. Now, in this presentation, my focus will be on the WASH and health sectors. So, a little bit of background information about this current crisis. So, the cholera resurgence that has been happening since October is not the first time that Ghana has seen a cholera outbreak. Their most recent one prior to this has happened in 2014 and 2015, and that one was actually a lot more deadly and affected more people than this current one. So, speaking of current, as of February, over 6,000 reported cases have been confirmed and documented, so sorry, ranging in how harsh the disease hit people because unfortunately some people have died with this. And this outbreak is mostly driven by poor sanitation, which I will talk about more as we go on in this presentation, but unclean water is one of the biggest driving factors in this outbreak. So it affects many areas in Ghana, but the five main areas that are hit the hardest are the Greater Accra, Central, Eastern, Western, and Ashanti regions, and the rural areas get hit the hardest. So this is a chart that I found off of the Ghana Health Service. This documents cases from October 4th, which if you look to the left side of the chart, you can see the cases start to rise around October 4th, and it ends on December 31st of last year. Now, one of the things you'll notice is that there's a lot of suspected cases and not as many confirmed cases. That's because the symptoms that happen in cholera can also happen in other diseases. The main symptoms are a lot of vomiting and diarrhea. So these confirmed cases are what we know of. However, there is room for still room for cause when it comes to these symptoms. So you'll see that around Halloween, there was a major spike in cases, and there's another major spike around December 11th as well. Now, this looks like a roller coaster, and that's because it is. So we also can see that at the end of the year, on the 31st, there hasn't been too many cases. However, although it's not currently charted, the cases are still ongoing to this day, and we need to work on making sure that they go away and stay away. So, what causes cholera? What causes it? Well, it's because a lot of people who get cholera, they lack access to basic sanitation. So, indoor plumbing, clean water, soap, any type of hygiene products that are easily accessible, so sorry again, for you and I at the store are not as accessible for a lot of people who live in these rural communities. Now, another issue is with the water. A lot of cases have to do with poorly treated water. So On this slide, I mentioned that wastewater is an issue, flooding is an issue. The defecation in public and the overflowing sewage is a huge issue. So the latrines, the bathrooms are not as, what's the word, up to date as we see here in the West. So people still openly defecate in these rural regions, and after the defecation, if there's rain or water, that can spread into the regions and areas that people live in, and they could get it on their hands, it could go in their food, it could go in the water they drink, and thus that bacteria can cause the cholera. And cholera, as I've said before, can be deadly if not treated. So, what are some of the challenges that people face? Well, there's quite a few. Health-wise, in these rural communities, there's a shortage of these IV fluids and antibiotics. So if people are vomiting and having diarrhea a lot, they're getting dehydrated, their body's getting dehydrated, and dehydration, as we know, can lead to death. So another challenge that is being faced is the poor access to healthcare and finding healthcare workers that can help these people that are being affected. So in these rural communities, in these slums, not a lot of people can get there to help as much as the communities need help. And when flooding happens, that also hinders access to who can come in and help. They might get blocked out just from the water. Um, there is a shortfall of scale and sustainability because of funding. As we know, a lot of these communities rely on funding and outside help when it comes to these major outbreaks because small communities can't often handle these large scale crises. So one of the things that I would love to implement is called WASH. Now, WASH stands for Water, Sanitation, and Hygiene, and it's one of the main things that can help prevent prevent cholera from spreading. Now, this has been known to work in other communities and other countries before, so it is a viable option. Now, on the screen here, I have a poster from Water Rome that goes over some of the everyday things people can do to help stop the spread of fecal matter going, transmitting orally. So it goes with water sources, making sure water is treated and stored properly. And this also goes into the sanitation, making sure that feces stay out of the water supply, that flies stay out of the food supply. Anything that can track feces needs to stay out of the areas where people can ingest something, whether that's food or water, or even if they have a habit of putting their hands in their mouth. So making sure that hands are clean, that food is covered. These are all things that we can implement every day to help stop the spread of cholera. One of multiple things that encompass the WASH are things such as vaccinations and mobile clinics, trying to get as many people taken care of as possible. Um, Adding chlorine to the water, making sure it's safe for drinking and using every day. And also, I like this one, distribution of hygiene kits. So making sure communities have access to soap and water containers and menstrual hygiene products. That's another big one. All of these things can make a huge difference when it comes to how many people are being affected by cholera. Now, there are health sector interventions that can also help. Now, some of these things may be harder to get to than others. One of these is in the middle here, getting essential medicines and IV fluids. That is definitely a challenge, but if we train more healthcare workers, whether they are healthcare workers in the community or volunteers that come to help out, getting more people in the community and getting cholera care into the system can really, really make a difference in people's lives. So, establishing CTUs and mobile health teams, probably the best bet since a lot of these villages cannot have um, major hospitals and treatment centers. They do not have. So, now, this is a very preventable disease. It's very preventable, yet there's a lot of inequalities that come with this disease. So, as I mentioned on the second line here, the population is growing, so the WASH services are very, very important to start implementing. The outbreak harms everybody, but especially women, children, and displaced persons. They are all at a very high risk of getting cholera, and we don't want that. So we need to intervene now, as soon as possible, get what we can to help these communities. Because when we help communities, the communities trust us, and that really creates all the difference, and more people live, and more people continue to live happy and healthy lives. Thank you so much. I appreciate your time. Thank you.